Ever wondered how a vitrectomy surgery is performed? Let's take a quick look inside the eye and break it down in just over a minute. A vitrectomy is a delicate eye surgery done to treat problems like retinal detachment, macular holes, or bleeding inside the eye. First, the patient's eye is numbed with anesthesia so they feel no pain. The surgeon then makes tiny incisions, usually less than a millimeter wide, in the white part of the eye called the sclera. Through these openings, the surgeon inserts very fine instruments, including a light source, a cutting tool, and a suction device. The main goal is to remove the vitreous gel, the clear, jelly-like substance that fills the eye, to give the surgeon better access to the retina at the back. Once the cloudy or blood-filled vitreous is removed, the surgeon can repair any retinal tears, remove scar tissue, or fix a detachment. After the repairs, the eye is filled with a special fluid, gas, or silicone oil to help the retina stay in place as it heals. Finally, the tiny openings are sealed, often without stitches, and the patient wears an eye patch for protection.